Hi, I'm Dr. Robert Gregori. I'm a physiatrist and practiced for decades in the work comp arena treating injured workers. In 2009, I launched a company called Objective Medical, which is a forensic practice. And in 2012, I started a company called Objective Diagnostics. We work with other providers in an attempt to reduce cost and facilitate prompt care and maintain quality throughout the process. We had success there, and in 2014, we launched the concept of developing a network of surgeons, surgery centers, therapy providers, and promoting surgical care for the work comp injured patients. That's prompt, that's quality, and that has good outcomes for a reasonable price. At Objective Medical, I've been determining causation, and we carry that through with all of our surgical cases that are evaluated. We promptly get patients in to see the surgeon. The surgeon determines what caused their condition, whether surgery is needed, and then we can facilitate that course of care without delays and prompting the patient to get the appropriate care in an expedited manner so that they can recover sooner and get back to work. With both our diagnostic and our surgical programs, we have a great network of providers, and we're able to get the patients in quickly so that their treatment can be expedited. The longer an injured patient sits without care or has delays in treatments, the worse the outcome. So part of our goal is to get them to the appropriate provider quickly and have that provider answer the questions, determine if they need surgery. There's no more delays. We have the surgery center all ready to go. We have therapy already after surgery. And so it's a seamless effort of getting a patient through that episode of care with the least amount of delay, with the least chance of having complications, and with the best outcomes. We have numerous studies in the work comp industry showing that the longer time a patient is off after an injury, the less likely they are going to get back to work, the more likely they're going to be disabled. One of the other advantages of our surgical program is we've developed it with a white glove mentality of service, and we have care coordinators that get assigned to a case from the time they're being evaluated by the surgeon to all the way to the point of them being discharged after 20 therapy visits following a rotator cuff repair. And that care coordinator is really holding that patient's hand, making sure they get to where they're supposed to be. If they have questions, get those questions answered, and just being there to support the patient's need. Our goal is ultimately to give the patient the care they need to provide a great outcome. But in doing so, we recognize that there's multiple moving parts in this equation. So we are constantly coordinating our treatment between the insurance or TPA, the nurse case manager, if one's on the case, the provider's office, and ideally the patient is right in the center of that. And our care coordinator helps to make all that come together in a smooth way. As a provider that had 20 years of experience in a large orthopedic practice, I just recall I'd order an MRI on a patient, and then there'd be a delay, and they were asking why, and you had to send them to therapy first. And as a provider, that's very frustrating. We have these great relationships with the surgical practices, orthopedic practices, and if we ask them to do the surgical case, they know what the price is going to be, what we're going to pay them. They know that we're going to promptly pay them what they agreed to, and they know that we're going to help with that care and make sure we are getting to the insurance company what they need, and as well making sure the patient gets to where they need to be. So the providers feel that we make this course of treatment easier on them, and it's very important that our providers are on the same page with us. We don't look for providers that are just willing to do surgery for a low cost. We look for high quality providers that consistently provide the care the patients need to have a great outcome. It's amazing when I look back at how we started with just a couple employees 15 years ago and what has grown into this large company that is serving such important needs. We have a great working environment. Everybody likes to come to work, and it's a great feeling when you have created something that can give all these employees opportunities to work, but in an environment where everybody gets along well. All of our employees are very familiar with what our goals are. We work towards that goal as a team. We are all there to support each other, and we get the job done.